Before we get started, I have a quick favor. I've been self-funding the Finding Genius podcast for 5 years now. I've done over 3,000 episodes. And as you can see on YouTube, we're up over 1 million views on the channel, which is fantastic. The next thing I really want to push on is to get up to 10,000 subscribers. Because once we do, we'll be able to put a donate button and we'll be able to solicit donations to help keep the podcast running and to also get the Finding Genius Foundation moving along. We have a big project studying anxiety, depression, and PTSD and working on a product to help people overcome these problems because I've seen them explode recently after the last 2 years of the whole virus situation. So if you would, please subscribe to the podcast. That would help us tremendously. Give us a thumbs up and check in the description for Buy Me a Coffee. It's about $5. If you could buy me a coffee, I'd really appreciate it. It would help keep the channel going, and I love coffee. Thank you.
Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
Go above and beyond.
they become very good at what they do, but only
0.1%.
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast
With Richard Jacobs.
Hello, this is Richard Jacobs with the Finding Genius podcast, now part of the Finding Genius Foundation. My guest is Dobri Kiprov. He's an internationally renowned pioneer and expert in therapeutic apheresis, immunotherapy, long COVID, and age-related disorders. We're going to talk about what's called therapeutic plasma exchange, TPE, taking young blood and transfusing it into older people to change their physical state. So welcome, Dobri. Thanks for coming.
Sure. Well, glad to be here.
Yeah, first to start, tell me a bit about your background and how you got into this area of science.
I'm an immunologist. I did my fellowship in Harvard at Mass General. And at that time, plasmapheresis was just emerging as a therapy for a variety of autoimmune diseases, as well as transplant rejection. I was heavily involved in nephrology, kidney diseases, and we did a lot of transplantation at the time. And we treated patients with rejection to try to slow down their immune system and help them with the new organ. That's how I started. Then I was recruited by a neurologist, Peter Dow, who was the pioneer of plasmapheresis in the United States. And he was treating a variety of neurologic diseases, and I was heavily involved in that. And we tried to figure out the immunologic background of some of these diseases and what effect plasmapheresis has on the immune system.
So this is not a whole blood transfusion, it's just the plasma component?
Yes, it is not a whole blood transfusion. It is just the plasma component. That's correct.
What are some of the trade-offs doing just plasma versus whole blood? And I know it depends on why the transfusion is needed, but I guess another way to put it is, why would plasma be needed and not whole blood? What circumstances would need that?
Well, there is no reason to exchange whole blood except for certain medical conditions, usually, very severe diseases and so forth. So whole blood exchange is limited to, as I said, to very few medical conditions. Therapeutic plasma exchange is removal and replacement of the plasma, which is the fluid portion of the blood, with return of the cells. So indeed, in the autoimmune conditions that I described, there are circulating autoantibodies, antibodies that attack your own system or your own organs, and the goal is to remove them. So there is no need to remove the cells. There is a need to remove only the plasma because the antibodies are in there.
Wouldn't cellular action, though, release all kinds of various compounds that would maybe stay in the plasma for a while? So I would think the nature of the constant, the mix of or the composition of the plasma would change all the time.
Well, this is pretty complex, but in general, what is accepted now, I don't think we have the time and to delve into all this complicated subject, but plasmapheresis is an accepted treatment for a variety of autoimmune diseases, and whole blood exchange is limited to very few severe medical conditions.
Okay, no, fair enough. So what happens in plasmapheresis? The blood is withdrawn, the plasma, I guess, is separated, and is the other remaining components put back into the body?
Correct.
Or, what goes back into the body minus the plasma? What's left to put back in?
So the cells, all the cells, the red cells, white cells, platelets, they all go back along with replacement fluid. So the plasma, we usually remove 2-3 liters of plasma, so we have to replace it with something. And the most common solution today for replacement in plasma exchange or plasmapheresis is 5% albumin. 5% albumin is produced from donated plasma, but it is purified and certain parts of the plasma is removed, like coagulation factors, clotting factors, immunoglobulins. These are removed, and only albumin has remained. And albumin is the major portion of plasma, and it's a protein. It has oncotic pressure, which keeps the blood pressure high. So it's the most commonly used exchange fluid. In certain diseases, not very commonly, we use fresh frozen plasma as a replacement, and fresh frozen plasma is derived from a variety of blood donors.
Okay. What happens to the removed plasma from the person that, is in need? Is it just thrown away? Is there anything else salvageable about it?
For research purposes, yeah, you can use the removed plasma, otherwise it's thrown away.
Wouldn't this be a good time to do some analytics on the removed plasma to find out more?
We do, yeah.
There'll be, okay. What kind of things do you look for?
There is no question about it. A lot of pharmaceutical companies and other research scientific companies are very interested in the plasma that's removed from the patients we treat. And there are actually people who selectively remove plasma from this kind of patients and sell them to companies to do research. They research the autoantibodies that I discussed. They research other proteomics and metabolomics, and we do that too.
Okay. So when plasma is donated, how is it processed before it's put back into someone?
There's a process called clone fractionation, and this divides all the proteins in the plasma in different sections. Immunoglobulins are one, these coagulation factors is another, and albumin is the third one. And today's technology allows for the separation and purification of each one of these components, and they collect them and they purify them and they sell them as pharmaceutical. After the processing, they become a pharmaceutical. They are no longer considered a blood product. So in the meantime, while this process is going on, they undergo a variety of thermal manipulations, so they exposure to heat and other chemical manipulation as well, which pretty much removes any viral particles or anything that can transmit infection.
Okay, and then it's put back into the patient. How much is withdrawn and how much is put in, and does that depend on condition?
Depends on the condition, but in general, it's about 1 plasma volume, and this equates to 2 to 3 liters generally.
Okay. So what happens when the new plasma is introduced? Is there an adjustment period where the body will, like biomarkers will significantly change or metabolic action will significantly change until like a new equilibrium is established?
Well, the 5% albumin is a very benign and actually very helpful fluid. It's protein. It's the most significant antioxidant in the human body. It has an immunomodulatory effect. It has an anti-inflammatory effect. So you're infusing pretty much good stuff. The body does not necessarily have to adjust to any of this. It just thrives to have the plasma replaced with the albumin at the time. So there is adjustment of coagulation factors because we remove clotting factors, but within 24 hours, they usually get back to normal.
So for 24 hours, is the person less likely to be able to clot if they suffer an injury? Or do they have to be careful?
That's true, but it is not that dramatic. I mean, I've been doing this 4 years. I haven't seen bleeding at all, but it's a good idea to be careful for that because we do reduce the clotting factors. We don't remove all of them, so there is still clotting that is happening, but for about 24 hours, it is a good idea to drive your hospital slower.
Okay. I mean, what if someone's in a situation where let's say they have, an existing clot and they would normally be put on blood thinners? Could this be a proxy for that instead? Could this protocol be more effective than just putting someone on blood thinners?
If somebody's on blood thinners, then the procedure is adjusted to account for that. So it's not a problem. We can manipulate the doses of the blood thinners. We can give them during or after the procedure. That's not a problem.
But I mean, could it be used in place of that? Would it be as beneficial? Would it work as fast? Would it actually be better in certain circumstances?
It is used in coagulopathies extensively, actually. It is not necessarily affecting directly the coagulation system, but certain aspects of the coagulation system are are involved in that. So yes, you're right. In coagulation illnesses, this could be beneficial in certain circumstances.
Yeah, what if someone has existing clots they don't know about? Now they would be a lower concentration of certain materials in the plasma that would circulate. Would that cause possibly clots to come off their moorings and go into the bloodstream and then, clog up a vessel, or it doesn't seem to affect them?
No.
Okay, well, that's good. That's excellent. So the main therapeutic component is the albumin, it sounds like. Is that correct? The albumin is the main therapeutic component, or what is... So in TPE, what is the goal then? Is it only to be used for people that have autoimmune problems? Or, what if someone, I don't know, wants to do like let's say a regenerative medicine type application? Has it been used for that yet?
Yes, it is. I mean, I pioneered this approach. But basically, apheresis is an old Greek word, and it means to take away. The main reason for doing plasma exchange is to remove stuff from the plasma and from the body. Because if you remove certain antibodies or other substances from the blood, some of those substances may be present in tissues, and they go into the bloodstream, and when you apply the procedure again, you remove them. So yes, there is a component of beneficial component because of the removal of certain things, and the albumin has additional beneficial effect.
Before we continue, I've been personally funding the Finding Genius podcast for 4.5 years now, which has led to 2,700 plus interviews of clinicians, researchers, scientists, CEOs, and other amazing people who are working to advance science and improve our lives and our world. Even though this podcast gets 100,000 plus downloads a month, we need your help to reach hundreds of thousands more worldwide. Please visit findinggeniuspodcast.com and click on Support Us. We have 3 levels of membership from $10 to $49 a month, including perks such as the ability to see ahead in our interview calendar and ask questions of upcoming guests, transcripts of podcasts you're interested in, the ability to request specific topics or guests, and more. Visit findinggeniuspodcast.com and click Support Us today. Now back to the show.
Oh, what kinds of substances they removed and what kind of pathology did they create?
As you mentioned, the main diseases that are treated with plasma exchange are autoimmune diseases. So we remove a variety of autoantibodies and immune complexes. That's probably the main target. However, it can be very helpful in acute toxicity. People who are exposed to a variety of substances, could be medication poisoning, could be mushroom poisoning. It also removes, mercury and this kind of stuff. So
it can act kind of like a chelation therapy as well?
I hate this word, but yes.
Okay, I understand. I know because there's practitioners that have kind of ruined the word, so I understand why you don't like it. Okay, so for someone with an autoimmune condition, would they do this monthly to keep themselves in a good state? Like it sounds like a protocol that has to be done on a regular basis for people with those problems.
Correct. You have to realize that regardless of the diagnosis, every patient is different. So I adjust the treatment according to the individual that we treat and not the diagnosis necessarily. And they come to us when the medications that are available today fail. And the plasmapheresis is usually combined with a variety of immunosuppressive medications, and the medications can take over. So if there is an acute episode of certain autoimmune disease, we do plasmapheresis and then put the patients on medications. You can use it as a chronic treatment as well. It varies. It depends.
So if someone's getting this regularly, could they reduce or maybe even eliminate immune-depressing medications? Could they reduce them?
Yes. The answer is yes.
That's excellent, yeah. Do they eliminate them, or is it not good enough to do that?
Well, again, everybody's different, and the diseases are different, the stage of the disease and all that, so there is no one.
So it sounds like this might be a good protocol before and after a transplant surgery. You kind of clean out the system before, and then, shortly after a transplant or right after, maybe you do this more aggressively, maybe once a week, and then it slows down to once a month to make sure that there's not organ rejection. Would a protocol like that help, you believe?
Yes, definitely. We use it as a preparation before surgery and afterwards in renal transplant, kidney transplant, heart transplant. I have a history of numerous patients who actually have benefited from that.
That's great, yeah. It'd be funny if you told people like you're 400 years old and it's because of these TPE treatments it keeps you young, I'm just kidding, but
I'm working on that.
Right on. Okay. So is this available for, again, athletes or people that just want to do regenerative medicine under a doctor's care? Is it available for, can someone get TPE therapy without having an autoimmune problem?
The answer is yes. The machine, the blood cell separators available in the United States, there is no FDA approval at the moment for individual diseases. So if you're a physician, licensed physician, and you have access to this instrument, you can perform or prescribe plasmapheresis for anybody you want. Now, whether this is a good approach or not, it's difficult to say. Individual people have different opinions and so forth. So there are clinical studies that are done in certain diseases, and recently we did one in, as you suggested, in aging and longevity. So the gold standard of medicine is to perform placebo-controlled clinical trials in order to prove that certain procedure or medication is beneficial in certain conditions. So there are studies like that in a variety of autoimmune diseases. And as I mentioned, we just finished a study for longevity or rejuvenation. So we're trying to be as scientific as possible, mainly because of the safety of the patients, but also the effectiveness. If this thing is not effective, then why doing it?
Right. So now it sounds like we turn to the donors. So I guess you're evaluating younger donors versus older donors that have a certain physicality about them or certain, biomarkers that may be better for someone that has a certain condition. Like, is there matching that goes on? Or, as long as the donator meets certain criteria, it's fine. Use it.
No, so you have to educate you here a little bit. We don't use donors at all. As I mentioned, we use 99% of the time 5% albumin, which at the time we are buying it and using it is a pharmaceutical. It's no longer considered a blood product, although it is derived from human plasma. But it's, we buy it from the pharmacy like you buy aspirin, same thing. We don't use donors. I think that the idea of infusing young blood from certain young people into older people, this was triggered by an experiment performed 20 years ago. Irina and Michael Comboy at Stanford at the time, they connected an old mouse to a young mouse via their circulation. So they combined the circulation of the two mice so that diluted blood of mice got into both the old and the young mouse. And people forget the main thing in this experiment was that the young mouse got older. At the same time, the old mouse got younger. Everybody forgot that the young mouse got older, but they don't forget that the older mouse got younger, and they flooded the blood banks and they wanted young blood and all that. So the idea was that, yes, young blood contains some substance or substances that rejuvenate the body. Since then, a lot of very good scientists and a lot of money was thrown into finding these factors, because obviously this would be a dramatic event. And I know companies who have invested $50 million, $100 million and hired some of the best people in the world to try to find out the young factors. It's been 20 years since then. A lot of money, as I said, and a lot of work by very prominent people. Nothing has been found.
So there would certainly be no such thing as young plasma either, I guess.
Well, I'm not saying that there isn't, but I'm saying that so far, after 20 years of major efforts, we have not just we, everybody on Earth has been looking for that, and they haven't found anything. So at this stage, the infusion of young plasma or young blood has to be considered mythology rather than medicine. It's just there's no proof that it works. So I developed a theory and published that to try to mimic what the Comboys did in humans, and plasmapheresis seemed to be a good approach. And initially I considered, well, why don't we use plasma from young people? And the reason I rejected that idea, and I still do, is because when you infuse foreign plasma or foreign anything in your body, you create a reaction. Inevitably, you create a reaction. So whether it's blood, whether it's only plasma, whether it's red cells, something else, you create a reaction. And these reactions, and I've been doing this for 40 years, these reactions are relatively mild in most cases. However, on occasion, they can lead to horrible conditions, including death. And of course, there are deaths from young plasma being given to older people who want to be younger. So people died, and the FDA got involved and said, well, we have to stop this practice. Unfortunately, it's very unfortunate. There are physicians who still use this practice, and I can't justify that in anybody. And my idea was, listen, we are taking 5% albumin, which is made from plasma donors. Their average age is 25 years, so they're relatively young. At the same time, we supplement the removed plasma with immunoglobulin. That's another protein that is found in plasma. This is also taken from younger donors. So probably 85% of the plasma is what we give these patients, but we give it in a safety way. They don't have any reactions. They don't have any problems. And if there is anything in young plasma, we're probably infusing it already. So I think that the first thing a physician should do, and that's what they teach you in medical school, is do not harm. And giving young plasma to anybody is harmful.
I understand. So now it makes total sense why you'd use, this from the pharmacy. It's clean. It's a lot safer. Makes sense. Regardless, though, what are some of the side effects of doing this? Are there any? Like, what happens to someone that gets this in their regenerative medicine capacity?
What we do, or
what do you do with the 5% albumin, the immunoglobulin?
Right. So we did a study, a very large controlled clinical trial in Alzheimer's disease. And the study was done in Barcelona and the United States. I was in charge of the treatment in the United States. Overall, we performed about 4,000 procedures during this study, and we had 7% mild reactions that we saw. And primarily they were seen in Spain because they used vascular access with catheters, and these get infections and so forth. In the United States, we refused to use catheters. We used only peripheral veins, and we had really zero side effects. In our clinical trial that just finished, we treated 40 patients and performed 640 procedures, and we had a single mild reaction to albumin. So the procedure is very, very safe, and there are no side effects or problems.
Okay. Have you done it yourself, or you've only done it on other people?
No, I do it regularly.
Okay. So what commentary do you hear from other people and from yourself? Like, what is the experience like afterwards?
The experience is different in different people. We have a paper which is in press right now, will be published shortly, and we have examined different blood tests and the biologic clocks of people, and usually we find that the biologic age of people is decreased. Not only that, the biologic age of different organs in the recipients is decreased as well. And there are other effects that are very important, such as is something called senolytic cells, and the senolytic cells produce pro-inflammatory factors which we remove. We remove lipids, and so there are a lot of variety of different beneficial effects. Not all of these effects are immediately felt by the patient. However, they prevent a variety of inflammatory diseases. So people don't die of old age. People die of disease. And the idea here is to prevent the age-related disease. And our clients don't suffer of these diseases for the most part.
But again, what do people anecdotally say? In addition to the biomarker changes, biological age, do they sleep better? Do they feel more mentally alert? Like, what are some of the things that people have experienced?
Well, we have testimonials from a lot of people. These are present on videos on my website. People can go and check them out. I'm not going to repeat what the people say, but there are testimonials that are very impressive.
Like, what categories of improvements, without repeating it verbatim? Again, do people notice that, I know everyone's different, but do some sleep better, or is there more mental clarity or more energy? In general? Oh, okay. How long does the effect last between treatments? Does it last like 24, 48 hours and then go away, or do they feel great for a whole month?
Our protocol calls for 6 treatments. It is possible that we can achieve this effect for less than 6 treatments. However, aging is a chronic disease, so it needs chronic treatment. A single course of treatments will not be sufficient, so we recommend quarterly that patients get the exchange.
Yeah, I think the whole reason I found you is I saw an article that Peter Diamandis, the founder of the X Prize, has a picture of himself doing it, and he talked about it. So I believe that's how I found you. So I guess at least one semi-famous person is doing this. I'm sure a lot of others. So in order for someone to do this, are there multiple physicians that offer this, or is it very, very small right now, like only a few or only you? How widespread is it?
We discourage people to use that kind of whoever is offering it. We have cumulatively in my clinic, we have 150 years of experience. You can buy a machine, you can take a course, but you cannot buy experience. We have more experience than anybody else on earth, both as physicians and nurses as well. So we have, my main clinic is in Northern California, in Mill Valley. We have opened clinics around the country. At the moment, we have 10 different clinics. We have 3 clinics in Florida. We have 3 clinics in Southern California, 1 in Northern California, Seattle, and we are opening clinics all the time. So by the end of next year, we'll probably have a clinic in most geographic areas, but including other countries. We have a clinic in Australia. We're working with Southeast Asia as well as Europe.
Okay. So do people come just only if they have some, medical condition, an autoimmune condition, or you mentioned doing this to people, I believe, with Alzheimer's or some other cognitive decline disorder. Do you have people that come to do it for a regenerative medicine reason? Is that allowed at your clinics?
Yes, we have quite a few people that come from all over the world, actually. We have patients that fly from Europe. We have patients that used to fly from Australia. Now we do it there. We have from Asia, a number of patients from Asia who also travel to come here. So yes, we do it for regenerative reasons as well as medical conditions.
Yeah, people are flying around the world to do it. Must be pretty significant, the positive effects from it. Although I know they can't be promised, but yeah.
Well, they wouldn't come. I have people that come repeatedly every 3 months. So if they don't feel good, they wouldn't come, I assume.
Right. Okay. What's the future of this? So you have a ton of experience in doing it. What do you see as like maybe the next step, expanding this to more conditions or, further amping up efficacy of it?
Yes, all of these things. Our clinical study that we finished now is the only one. I think we will do a larger study. I'm trying to, raise money to do a larger study. We are working on enhancing the potency of the treatment with other stuff. I'm not freedom to discuss that, but we're looking at additional manipulation of the body to enhance that. And in terms of expanding it for other diseases, I recently published an article called The Paradigm Shift in the Use of Therapeutic Plasma Exchange in Clinical Practice. And the reason we did that is to move therapeutic plasma exchange from the hospital to the outpatient facility, which makes things much cheaper, and also the emergence of certain diseases. So Alzheimer's disease is new to the field of therapeutic plasma exchange, but in addition to that, there are other diseases. One of them is long COVID. We treat patients with long COVID as well. Chronic fatigue syndrome is usually for children mainly, but we see some young adults as well, called PANDAS. So there are relatively new diseases that are emerging that are successfully treatable with plasma exchange.
Couple more questions. So the study that you did in people with cognitive decline, what happened there? What were the results?
This is published in numerous publications. So in patients with moderately severe Alzheimer's disease, we were able to stop the progression of the disease. In mild Alzheimer's disease, and I think the focus should be here in the mild cases, we see not only we stop the progression of the disease, but we see improvement in cognitive function, speech, and so forth.
That's excellent. Well, very good, Dobri. Where can people find out more about your work and see the testimonials and find the clinic locations?
GlobalApheresis.com is my website. And if they have questions, there is telephone numbers, emails. They can call me directly. I do free Zooms with people who are interested. There's no charge for my consultation. So I have physicians who are very experienced and have been my students, and they work with me all over the country, all over the world, actually. So people can get a lot of information and advice by contacting us.
Okay, excellent. Well, Dobri, thank you so much for coming on the podcast. I appreciate it.
Sure.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.